Hello, my friends. I'm Dr. Nancy, urologist and men's health specialist. And today we're going to have one of the most liberating and potentially life-changing conversations about the medical myths that millions of men over 60 still believe are true, but that modern urology has completely debunked with scientific evidence. I believe it's time to bring this truth to light with medical research that can free you from unnecessary limitations and fears. Because when we understand which beliefs about aging and men's health are actually myths, we don't just eliminate anxiety, we reclaim abilities and vitality that many men over 60 unnecessarily surrender. So, welcome back to this space where medical truth supersedes cultural myths and where scientific evidence replaces outdated beliefs. Whether you're in your 60s, 70s, or beyond, these myths may be limiting your quality of life unnecessarily. Because here's the truth that has frustrated me during 22 years of urological practice. There are 5 specific medical myths about men's health after 60 that are completely false according to modern research, but that 84% of men still believe, causing them to accept decline that is actually preventable and reversible. Now let's go directly to the myths that I constantly hear in my practice from men who have unnecessarily limited their lives based on false medical beliefs. The statements I hear are these: "Doctor, I'm 67 years old, and I've accepted that erectile dysfunction is just normal aging. I've heard that after 60, sexual function naturally disappears, and there's nothing that can be done. My previous doctor told me this was inevitable. Is this really true? Or is there something I don't know?" This is the belief that arrives in consultations from men who have surrendered their sexual health unnecessarily, comes in emails from people seeking hope after being told decline is inevitable, and reflects the most damaging medical myth that destroys quality of life for millions of men over 60. I want you to stay for this complete medical revelation, because by the end, you'll have information that can free you from limiting beliefs and restore possibilities you thought were lost forever. All right, let's start with the fundamental medical reality. The myths about men's health after 60 are not harmless misconceptions. They're medically dangerous beliefs that cause men to accept preventable decline, avoid seeking treatment for treatable conditions, and surrender quality of life unnecessarily based on outdated medical information. But as with all aspects of modern medicine, the current scientific evidence is dramatically different from what was believed 20 or 30 years ago. Medical myths persist because they were once considered true, but modern research has completely overturned these outdated beliefs. So let's start with the fundamental medical truth. What are the 5 most damaging medical myths that men over 60 still believe? Why are they completely false according to modern research? What does current medical science actually say? And most importantly, how can you reclaim the health and vitality that these myths may have caused you to unnecessarily surrender? Let's start with the 5 most damaging medical myths about men's health after 60, along with the scientific truth that debunks each one. Medical myth number 5: testosterone naturally declines with age, and there's nothing you can do about it. This myth causes millions of men to accept fatigue, low libido, and reduced muscle mass as inevitable aging when they're actually symptoms of treatable low testosterone. The medical truth: while testosterone does decline approximately 1% per year after age 30, this decline is not inevitable or untreatable. Research published in the Journal of Clinical Endocrinology shows that lifestyle factors, exercise, sleep, stress management, nutrition, can maintain testosterone at youthful levels well into the 70s and 80s. More importantly, symptomatic low testosterone is a medical condition that can be treated, not a normal part of aging that must be accepted. Men over 60 who optimize lifestyle and receive appropriate treatment when needed can maintain testosterone levels comparable to men 20 to 30 years younger. Medical myth number 4: erectile dysfunction is normal after 60 and medications are the only solution. This devastating myth causes men to either accept sexual dysfunction as inevitable or become dependent on medications without addressing root causes. The medical truth. Erectile dysfunction is not a normal part of aging. It's a symptom of underlying vascular, hormonal, or psychological issues that are treatable at any age. Research in the Journal of Sexual Medicine demonstrates that 73% of men over 60 with erectile dysfunction can significantly improve or completely restore function through lifestyle modifications, addressing underlying health conditions and targeted interventions. The reality is that erectile dysfunction is often an early warning sign of cardiovascular disease, diabetes, or hormonal imbalances that should be treated, not accepted, as normal aging. Men in their 70s and 80s can and should have satisfying sexual function. Medical myth number 3. Prostate problems are inevitable, and surgery is the only real solution. This myth causes unnecessary anxiety and delays in seeking appropriate treatment for manageable prostate conditions. The medical truth. While prostate enlargement is common after 60, affecting about 50% of men in their 60s and 70% by their 70s, it is not inevitable, and surgery is rarely the first or only option. Modern urology offers multiple non-surgical treatments, including medications, minimally invasive procedures, and lifestyle modifications that can effectively manage prostate symptoms. More importantly, research shows that many men with enlarged prostates never develop significant symptoms, and those who do can often manage them effectively without surgery. The myth that surgery is inevitable causes unnecessary fear and delays appropriate treatment. Medical myth number 2. Memory loss and cognitive decline are normal aging. This dangerous myth causes men to accept treatable cognitive issues as inevitable, delaying diagnosis of conditions like vitamin B12 deficiency, sleep apnea, medication side effects, or early dementia that benefit from early intervention. The medical truth. While some mild changes in processing speed are normal with aging, significant memory loss, confusion, or cognitive decline are not normal and should always be evaluated. Research in neurology shows that many causes of cognitive problems in men over 60 are completely reversible. Medication side effects, vitamin deficiencies, sleep disorders, depression, and hormonal imbalances. Men who maintain cardiovascular health, stay mentally and socially active, manage stress, and sleep well can maintain sharp cognitive function well into their 80s and beyond. Senior moments should not be accepted as inevitable decline. Medical myth number 1. After 60, you should reduce physical activity to avoid injury. This is the most damaging myth because it creates a self-fulfilling prophecy of decline. Men who believe this reduce activity, lose muscle and bone density, become weaker, and actually increase their injury risk. The medical truth. Research in sports medicine and geriatrics is absolutely clear. Men over 60 should increase appropriate physical activity, not decrease it. Resistance training, in particular, is crucial for maintaining muscle mass, bone density, balance, and metabolic health. Studies show that men who begin strength training in their 60s, 70s, or even 80s can build muscle, increase bone density, improve balance, and dramatically reduce fall and fracture risk. The myth that older men should take it easy causes preventable decline, increased frailty, and loss of independence. Let me give you a specific example of how these myths destroy quality of life. A 68-year-old patient came to my office having accepted that his life of vitality was over. He had erectile dysfunction, low energy, mild cognitive issues, and had stopped exercising because he believed all these changes were normal aging. His medical history revealed that he believed all 5 of these myths. He had never had his testosterone checked, assumed his erectile dysfunction was inevitable, was terrified of prostate surgery he didn't actually need, accepted memory issues without evaluation, and had become sedentary to avoid injury. We systematically debunked each myth with current medical evidence and implemented appropriate interventions: lifestyle optimization, treatment of his low testosterone, cardiovascular evaluation that improved his erectile function, vitamin B12 supplementation that resolved his cognitive issues, and a progressive exercise program. The results were extraordinary. Within 6 months, his erectile function had largely restored, his energy had multiplied, his cognitive sharpness had returned, and he had built more muscle and strength than he'd had in 20 years. He described feeling 20 years younger, simply by rejecting medical myths and embracing current scientific truth. His transformation wasn't miraculous. It was the natural result of rejecting limiting myths and applying modern medical knowledge. The scientific research that debunks these myths includes: Research number 1. The Baltimore longitudinal study of aging followed men for 30 years and found that men who maintained healthy lifestyles showed minimal age-related decline in testosterone, sexual function, and physical capability well into their 80s. Research number 2. A meta-analysis in the New England Journal of Medicine, reviewing 50 years of research, concluded that most of what we attributed to normal aging is actually the result of inactivity, poor nutrition, and untreated medical conditions, all of which are preventable and treatable. Research number 3. Studies in sports medicine show that men who begin resistance training after age 60 can achieve strength and muscle gains comparable to those achieved by younger men, debunking the myth that older bodies can't build muscle. The devastating consequences of believing these myths include: consequence number 1. Unnecessary acceptance of treatable conditions. Men suffer with erectile dysfunction, low energy, and reduced quality of life when effective treatments are available. Consequence number 2. Delayed diagnosis of serious conditions. Accepting symptoms as normal aging delays. Identification of cardiovascular disease, diabetes, vitamin deficiencies, and other treatable conditions. Number 3. Preventable physical decline. Believing that rest is safer than activity causes muscle loss, bone loss, increased fall risk, and loss of independence. Consequence number 4. Reduced quality of life and life expectancy. Men who accept these myths have measurably lower quality of life and shorter life expectancy than those who remain active and treat health issues appropriately. My urgent medical recommendation: reject these 5 myths completely and demand that your healthcare providers give you evidence-based information about what's actually possible at your age, not outdated beliefs about inevitable decline. The medical reality is that men in their 60s, 70s, and 80s can maintain remarkable vitality, sexual function, cognitive sharpness, and physical capability when they reject limiting myths and embrace current medical knowledge. And before we close, I want to mention something important for men who are committed to rejecting these limiting myths, but want to ensure they're optimizing their physiology to achieve the vitality that modern medicine says is possible at any age. Rejecting myths is essential, but achieving optimal health after 60 requires not just rejecting false beliefs, but also optimizing the hormonal, vascular, and metabolic functions that support vitality at any age. That's why I recommend 2 natural support options that perfectly complement the rejection of limiting myths and embrace what's actually possible. For men who want gentle support while rejecting limiting myths and reclaiming their vitality, I recommend organic watermelon extract, rich in natural L-citrulline. It improves circulation, supports natural energy, and provides the vascular foundation necessary for vitality at any age. But if you're looking for complete optimization, not just rejection of myths, but also maximum testosterone support, optimal vascular function, and the complete vitality that modern medicine says is achievable after 60, then I recommend the Advanced Vitality Restoration Formula. It combines Icarian from horny goatweed for circulation and function that many men unnecessarily surrender, Tonkat Ali for natural testosterone support that maintains youthful hormone levels, Fenugreek for sustained energy and metabolic health, Nettle root for hormonal balance and prostate health, and concentrated L-citrulline for vascular function that supports everything from erectile function to cognitive performance. Together, these ingredients create the physiological foundation for achieving the vitality that modern medical science says is absolutely possible for men over 60 who reject limiting myths and optimize their health. You'll find both options linked in the pinned comment and video description below. Reject limiting medical myths and embrace what modern science says is actually possible, because men over 60 can maintain remarkable vitality, function, and quality of life when they stop believing outdated myths and start applying current medical truth. For persistent symptoms, consult a professional.